Okay, so percutaneous bougie-assisted cricothyrotomy. So when we're doing a cricothyrotomy in an adult, which is more likely to be done, and it's still an incredibly rare event. So landmarking, first thing you're going to do if it's a male, you're going to go to the jaw, palpate right down midline until you feel the first prominence. That's going to be Adam's apple. Your Adam's apple is your thyroid cartilage. Directly below your thyroid cartilage is going to be your cricoid cartilage. And the space between, just where you can put the tip of your finger, is going to be your cricothyroid membrane. Okay? For females, sternal notch, palpate up superior until you meet the first prominence. That's going to be your cricoid cartilage likely. Then you'll be able to feel up above, you'll feel thyroid cartilage up wider, and you'll feel the space between, and that will be the space. When in doubt, when we're doing our first, because we're going to be cutting down to get access to the tissue. So when in doubt, always midline. Lateral is bad. There's lots of stuff that bleeds. Midline, and we'd rather be inferior than superior. Superior is a cool tongue piercing, right? It doesn't do anything for you, right? Below is a tracheotomy. It's not our ideal site. The cricothyroid membrane, when we cut through there, the blade is going to be fairly well encased in cartilage. So it's hard to poke through the posterior side, and you can cut one side until you meet resistance and then flip the other and cut the other way. But it's kind of encased. Down near your trachea, that's not the case, right? So you can poke through the posterior of the trachea into the esophagus, right? And we don't want to intubate down through into some false passage and go through the trachea, right? So anytime that we're cutting, be thoughtful about the depth of your blade. That would make sense anyways. So what we're using for this mock-up, the equipment that you're going to need here is you need a scalpel. If I can pick it up, that would be helpful. You need a bougie, a size 6 endotracheal tube. The reason we're using a size 6 is it's the smallest size endotracheal that, for these bougies at least, that will fit over top of your bougie. You can't put a 5.5 over. It's really hard to advance it. Okay, so it needs to fit over. So size 6 endotracheal tube, a scalpel, a syringe to inflate your cuff when you're done, and obviously some iodine or isoproterenol alcohol to clean off your site. Whatever you have to make it as sterile as possible. It won't be sterile, it'll be clean. So you're going to landmark your site exteriorly. Okay, we're using a vent circuit and some skin that we harvested off a pig foot, which works really well. I've had the opportunity of doing one of these surgical airways on a cadaver, and it feels very similar, much better than the mannequins. So the first cut is going to be a head to toe cut, and it's to dissect down to the trachea. So to do that, you're going to lay the blade flat down, as flat as you can. Some would say finger out like this. No difference to me, but keep the blade flat, not the tip like this. You'll find if you're holding the tip, if the handle's above and you're cutting like this, you'll have a hard time cutting through. You want to lay the whole length of the blade down so you can do a cut. I'm going to landmark my position. I'm going to find a position. Now I know it all feels the same. I'm going to find a spot between. I'm going to visualize that. I'm going to set my blade about an inch above. I'm going to put pressure down, and I'm going to, I should mention what I'm doing with my dominant hand. I'm securing the airway with my down between my middle and my thumb finger, okay? I'll also have my index finger there as well, but you'll see what I'm going to do with my finger. So lay your blade down flat, pull, and make a nice cut. Okay. Now I didn't push hard enough because that didn't cut through. So you go back to the same cut, and you're going to cut down, and you're going to start to feel bumpies underneath your blade. Those are cartilage, right? That means we're down to where we can spread, and we want this soft tissue to be able to spread open wide, so you can take your finger and stick your finger in and put your finger exactly on the trachea. As soon as your finger's on the trachea, you find the cricothyroid membrane. You're going to take your blade, take the side that's sharp, and put it away from you. Put it in beside your finger, take your finger away, put your blade straight down, and we're going to stab through the membrane, and we're going to cut one way as far as we can cut. Then on the dull side of the blade, remember the dull side, I'm going to pull back against the dull side of the blade and rotate the blade. without taking it out of the hole. Then I'm going to cut the other way. Now I'm going to turn the blade away from my finger and take my finger and stick my finger in the hole and take my blade out. Okay? Head is here, sternum's there. So my cutting hand is going to be on their head. If you had to, you could pad their shoulders up with a leader bag to get them extended back out of your way while somebody's trying to ventilate if there's any air moving. You're going to shove your finger in the hole. It's going to feel snug on your finger. You're going to feel the cartilage up on top of your finger, and it's going to feel just like human. It's going to be very, very snug on your finger there. Then you're going to take your bougie. Then you need an assistant if somebody doesn't mind being my assistant. And you're going to take your bougie and shove it in right beside your finger. And shove it down until you meet hold up. It's not going to be very far because you're going from here down to your carina, right? It's not very far. So you meet hold up. Finger comes out. Assistant's going to put the tube on the bougie. So if you put the size 6 tube over that bougie. Now notice that I used the coude tip is actually up. So make the hard part to advance the first part. And so essentially you insert the straight part of the bougie into this in the opening. It's a lot easier to advance the tube over. You won't meet resistance. So then you're just going to hold, the partner's going to hold the bougie still and going to advance down. Remember, I don't want to be straight up and down. I want to advance towards their toes. Resistance, wiggle through. It's going to be well lubricated and advance in until you see the black line at the skin. Then you hold your own tube. Thank your partner. Tell your partner to fill up the cuff with the syringe. So nice and squishy, great. So we fill it up. CO2 goes on, and we ventilate first breath. We have CO2 in, so we get either color change or digital capnography, get CO2 to spike up a waveform. Then you're going to turn your ears to listen both apices to make sure that you're not right mainstem or left mainstem. Okay? If you happen to be a little deep, just deflate your cuff if you had to, or just pull your cuff back a centimeter and auscultate until you get equal air entry bilaterally. Okay? That should be fairly good placement with that. So as far as securing, going to be very, very difficult because you've made a big cut here. We're going to have lots of blood, and blood and tape don't mix well. The problem with tweel tie is that it's around their neck. For that to actually be useful, it's going to have to be snug, and we don't want to cut off venous return. I doubt that you would snug it hard enough to get arterial blockage, but we'd like to not cut off venous return from their head. Don't want their head to turn purple, whatever. But ideally. So this turns into one hand stuck on the patient's throat, pinching the tube and holding it flat down. Other hand on the bag valve mask. Anytime that there's not a hand on this, take your bag valve mask off, it's not going to just fall out of the patient's neck. It's going to be stable in there, but I'd like a hand there whenever possible. If you have a bag valve mask on there, it has to be a hand on there. You don't want to lose this. Okay. The one other thing that you can hit this or